Thermal screening at airports, quarantining and testing, and a deadly virus that spreads from bats to humans. Sound familiar? This time we're talking about Nipah virus after 2 cases were recorded in India's West Bengal state. Countries across Asia have stepped up their measures, including India, Thailand, Singapore, Hong Kong and Malaysia, prompting many to ask, will this be another pandemic? Let's get into it. Nipah spreads from animals to humans, putting it in the same category as COVID and Ebola. The virus comes from fruit bats but can spread to other animals and humans through contaminated food. It can also spread from human to human through close contact.
It typically can cause a flu-like illness. Some people can get a cough, some people get diarrhea, but the most feared complication is a brain infection called encephalitis.
The World Health Organization says Nipah kills between 40 and 75% of the humans it infects. There's also no vaccine or medicine to treat it. But if that's the bad news, here's the good news.
It doesn't seem to spread that easily. So outbreaks have generally been terminated with good public health measures.
The cases in West Bengal were both health workers, and around 200 of their close contacts have been tested with no further infections. Australia is watching closely.
We have very clear protocols for sick travellers. We've got no advice to change those protocols at this stage, but we're monitoring really on a daily basis.
This was ground zero, but all they knew then was pigs had a killer illness.
The virus isn't new. It was first identified in pigs in Malaysia back in 1998, killing more than 100 people and decimating the country's pig farming industry. And 7:30, then hosted by Kerry O'Brien, asked the same questions we're asking now.
How concerned should we be about an outbreak of the Nipah virus?
Once again, something has taken our smug human arrogance and said, ha! Surprise, here it comes, another microbe.
27 years on, we've seen small outbreaks most years reported in Bangladesh and India. But fewer than 800 cases have been recorded since 1998. To put that in perspective, the 2014 Ebola outbreak saw more than 28,000 cases in a couple of years. Then during COVID, there were almost 780 million cases worldwide, and it's thought the actual number was much higher. The small number of cases is part of the reason why there's currently no vaccine.
Even though there have been outbreaks every year, they've been small outbreaks, and they haven't been in big Western countries.
Several vaccines are in development, including one by an Australian research team that's using an antibody found in alpacas. So watch this space. In the meantime, experts say it's not cause for alarm yet.
It is very unlikely that Nipah is going to cause a pandemic in its current form. Like COVID, like influenza, it can mutate. So that is why it's so important to keep an eye on these outbreaks to make sure that the virus isn't changing its behaviour.